Hi everyone, my name is Princess, and for my project, I decided to dive deeper into antisocial personality disorder, also known as ASPD. So, in my presentation, I'm going to be talking about what ASPD is, the symptoms and DSM-5 criteria, the epidemiology, the etiological theories, treatment and research, cultural implications, counseling implications, and then a short video so that you can see exactly what ASPD can look like. A question I'd like you to keep in mind as we go through this presentation is, can a person with no remorse truly be helped? So what is ASPD? According to the DSM-5, antisocial personality disorder is a mental health condition characterized by persistent pattern of disregard for violation of the rights of others, often accompanied by manipulative, deceitful, and aggressive behaviors. Symptoms and DSM-5 criteria. Individuals with mental health conditions tend to show signs of lack of empathy and remorse, deceitfulness and manipulation, irresponsibility and disregard for social norms, impulsivity and aggressiveness, reckless disregard for safety or self and others, difficulty maintaining relationships, and criminal behavior. In ASPD, it ranges from 2% to 3% of the general population. It is significantly more common in males than women, with a ratio of 3 to 1. Incarcerated individuals have higher prevalence for ASPD. 80% male incarcerated inmates have ASPD versus 60% women inmates. Individuals with substance use abuse disorders have a higher chance of meeting the criteria for ASPD, with a percentage ranging from 16% to 49%. When it comes to homelessness, there is a correlation in the presence of ASPD. Research suggests that symptoms and behaviors associated with ASPD, such as disregard for social norms and rules, often appear before an individual who experiences homelessness rather than being a direct result of it. So while ASPD is not a direct cause of homelessness, it can increase the risk by contributing to behaviors that make it difficult to maintain housing, employment, and healthy relationships. Another contributing factor would be lower socioeconomic statuses. So in sum, evidence suggests that lower socioeconomic statuses is generally associated with higher rates of psychopathology, and more specifically with the development and expression of externalizing disorders such as ASPD and psychopathy. Interestingly enough, poverty can lead to chronic stress, which may negatively impact mental health and increase the risk of developing antisocial behaviors. Limited opportunities for education, employment, and social interaction can contribute to frustration and a sense of hopelessness, potentially leading to antisocial behaviors. Also, living in high crime areas can expose individuals to violence and criminal activity, which may normalize certain behaviors related to ASPD. According to the National Health Institute, a study found that residents in a lower socioeconomic status neighborhood is associated with poorer functioning and more personality disorder symptoms. So the risk of developing or having ASPCD is much higher. Prevalence of ASPCD does decrease with age, so individuals can learn to change their behaviors. So adults with antisocial personality disorder usually show symptoms of conduct disorder before the age of 15. So symptoms of conduct disorder include serious ongoing behavioral problems such as aggression towards people and animals, destruction of property, lying and overall dishonesty, theft, and serious violation of rules. ASPD and psychopathy. So psychopathy is a related concept to ASPD, though not synonymous with it. Psychopathy has 3 core features, so affective, behavioral, and interpersonal. The affective characteristics include callousness and lack of empathy, which is heavily prevalent in ASPD. Behavioral characteristics involve rule-breaking and impulsive tendencies, which is also a part of ASPD. Interpersonal attributes comprise shallowness, grandiosity, pathological lying, and manipulation of others, all heavily seen in ASPD. There is a high mortality rate for individuals who suffer from ASPD. People with ASPD are at risk for traumatic injuries, accidents, suicide attempts, hepatitis C infections, and other human immunodeficiencies, viruses. People with ASPD use a disproportionate share of medical and mental health services. One study that I read showed elevated death rates from diabetes mellitus, suggesting that some people with ASPD may neglect their medical problems or fail to comply with medical regimens. Some etiological theories surrounding ASPD does have to do with genetic, socioeconomic conditions, neurodevelopmental factors, and trauma. So when we talk about genetics, a genetic study proposed a hereditary component of personality disorders, including ASPD. So a family study suggested that 20% of individuals with ASPD have a first-degree relative also who has ASPD. Similarly, a large sample of male children who experience childhood abuse reveals a functional polymorphism in the gene encoding monoamine oxidase that moderately predicts the development of ASPD. So when it comes to trauma, genetics, and gene manipulation, parenting styles are likely to contribute to the development of ASPD. Adult antisocial personality traits are associated with experiences of parental neglect and abuse. So children who experience abuse or neglect may be more predisposed to development of ASPD. Some cultural implications. So different cultures have different views on their normalities and some of their behaviors. So what might be considered antisocial personality disorder in one's culture can be accepted as just a person's personality in another culture. For example, in Western cultures, they tend to be more individualistic, while in other cultures, they tend to be more collective and interdependent. So while everyone's doing everything together, everyone's also helping each other, versus the individualistic style where it's basically like an every man for themselves type of thing. Treatment and research. The management of anti-personality disorder primarily involves psychotherapy, with a strong emphasis on cognitive behavioral approaches that focus on reshaping the maladaptive thought processes and patterns, also behaviors of a person with ASPD. While there is no specific medication approved for ASPD itself, pharmacological treatments may be used to address individual symptoms or co-occurring mental health conditions. Now I'm going to play a video from a Law & Order SVU episode of a child who has ASPD with psychopathy. So now I'm going to play a video from a Law & Order SVU episode that I saw where a child has ASPD along with psychopathy. And now I'm going to play you a video from Law & Order where the child portrayed has ASPD along with psychopathy, so that you can see exactly what it can manifest into.
Are they gone yet? Yes, they just left. I don't want to see them again.
Well, that's up to you, Henry. You know that your behavior has consequences. If you can just remember to use your words rather than screaming and using your hands, you get to do the things you like.
I know. I'm sorry, Mommy.
It's okay. Let's talk more in the morning. It's past bedtime.
But I'm not tired.
Henry, it's late.
I said I'm not tired.
Lie down and I'm gonna give you kisses.
I said no.
Henry, you give me that knife right now.
As you can see in this short snippet of the Law and Order SVU episode, Henry shows a lack of empathy and remorse, deceitfulness and manipulation. When he says, "Sorry, Mommy," she instantly turns around like, "Oh, I know you don't mean it." Irresponsibility and disregard for social norms. It's not normal to have a knife under your pillow. Impulsivity and aggressiveness. You can see the instant shift when he's being told what to do and he doesn't like it versus what he actually wants to do. And then criminal behavior. He literally sliced his mom's hand just because she said it's time for bedtime. Going back to the question we had in mind, do you think a person with no remorse can truly be helped? Thank you.